Congressman Mike Ross has been at the epicenter of the debate on health care reform. He's the conservative Blue Dog Democrat Coalition's point man on the subject. Some say his group has been derailing efforts to push the health care debate forward. Others have hailed Ross and the Blue Dogs for their cautious conservative approach. Things fell apart on Friday afternoon. I caught up with Congressman Ross when he returned to Arkansas this weekend. Let's start first with the uprising on Friday in the House of Representatives. Obviously, this was an expression of frustration and an effort to make something happen rather quickly. What exactly happened, and is the process totally derailed in the House? And is there some mistrust now?
Well, I tell you, it was a very eventful day, I guess is the best way to describe it. We, when it appeared that this healthcare reform bill wasn't doing enough to contain cost, over 40 conservative Democrats joined me as the chair of the Blue Dog, the Conservative Democrats Healthcare Task Force, and sending a letter to the leadership saying that we could not support the current House healthcare reform bill, despite the fact that we're all for healthcare reform, but we didn't feel like it did enough at containing cost. You know, the biggest issue here, we really have two. One, 48 million people in this country do not have health insurance, and it's important that we have an affordable health insurance plan for them that they can purchase. But the other issue that a lot of people lose sight of is the fact that health care costs are growing at twice the rate of inflation. And if that continues, it's unsustainable for our government, and it's unsustainable for the American people. And I hope we can talk more about that in a little bit. But so for the last week, I've been the lead negotiator for the Blue Dogs. There are 7 of us, the conservative Democrats, known as the Blue Dog Coalition, that serve on the House Energy and Commerce Committee, which is where the health care reform bill is. And ironically, it takes exactly 7 no votes to stop a bill in committee. And we've been negotiating with Chairman Waxman in good faith for the last week, sometimes in 7-hour settings. We spent, it gets kind of blurry at this point, but I think Tuesday we were at the White House for over 3 hours, including more than an hour with President Obama. And then we'd meet 3 hours here and 4 hours here. And like I said, one session lasted over 7 hours. I don't think that sounds like anyone who's trying to kill health care reform. And we're certainly not. We want health care reform as much as anyone. We simply believe that the American people expect us to squeeze every dollar. The American people expect us to squeeze every dollar of savings that we can find in this very broken and very inefficient health care system that we have in this country. In fact, the point I would make is we spend more money on health care than any other country in the world. In fact, about $6,500 a year more per person than most other countries that are developed in the free world. And yet, we're ranked 19th in efficiencies. And so that's what we're trying to get at. And those negotiations went on for about a week. We have tried our best to play a constructive role in the legislative process. At the White House on Tuesday with President Obama, we reached an agreement on one of the 10 issues that we're working on. And then yesterday, or I guess I should say Thursday in the Speaker's office with White House Chief of Staff Rahm Emanuel, Speaker Pelosi, Majority Leader Hoyer, we reached another agreement on another issue dealing with if there is a public option that competes with private health insurance, that it needs to be the same as the Senate Help Committee bill in terms of having the Secretary of Health and Human Services negotiate with the providers for a network and on reimbursement rates, just like private insurers have to do, because we feel it's important that it remain on a level playing field. And then we were in negotiations Friday morning, and Chairman Waxman indicated to us that he could no longer agree to the 2 agreements we had. So we started with 10 issues. We spent the entire week getting to an agreement on 2 of them. And then he basically said that he could no longer honor those agreements on those two issues. And we had 8 issues still outstanding. So talks broke down, and it looked like that this bill would be stalled in committee until September. And he called an emergency meeting of the Democrats on the House Energy and Commerce Committee, and after tempers calmed down, he made a request of us to come back to the negotiating table, and of course we're going to do that. Of course we're going to re-engage in talks.
What's your best guess on how the process, if at all, will be resurrected? Is the House leadership going to try to pass it without the Blue Dog support?
Well, they can't. There's 7 Blue Dogs on the Energy and Commerce Committee, and it takes 7 Democrats on the committee to stop a bill. And then they can only lose, I believe, 39 votes on the House floor and pass a bill, and there's 52 of us. And I can tell you, I've never seen a group of Democrats more united and more committed than these Democrats are. And every single one of us are for health care reform. We just believe that we need to slow down and get it right. You know, Roby, in April, during the so-called break from Congress, I hosted town hall meetings in 35 towns. And I'll tell you what I took from that. The people that I represent were telling me that it's time for us to slow down on the spending. It's time for us to slow down on action and take the time to make sure that we get it right and to make sure that we actually have time to read the bills that we're voting on. And there's time to do that. I mean, we've been trying to do health care reform since Harry Truman. And, you know, the Senate's already announced that the health care reform bill in the Senate's not coming to the Senate floor until September. And the President has said he's okay with trying to get it done in the fall, and so there's no reason for us to rush this thing through the House. And so I'm just trying to do what the American people want us to do, and that's slow down and make sure we get it right, make sure that we're finding all the savings in this inefficient health care system that we possibly can, so that we can ensure that we can all have health insurance, those who don't have it today as well as those who do, not only for now but for the future.
Let me ask you a checklist of a couple of items that you feel have to be in a final version of a bill that you will support. Let's start first with universal coverage. Is that mandatory for you?
I think, well, the current House bill would basically require everyone to have health insurance, much like everyone's required to have automobile insurance. They've done it in a few states, and it's worked quite well. Basically, the way it would work is everyone would be required to have health insurance. But if you are a family of 4, making somewhere between $66,000 or I should say, if you're a family of 4, making somewhere between up to $66,000 or $88,000 a year, that number's not been settled on yet. On a sliding scale, you would qualify for a subsidy to help you pay for it. The bottom line is, for those who do not have health insurance today, they may be going without the kind of care that they need, but they're still getting care. They're getting care in hospitals, and they're getting care in emergency rooms. And in fact, for those of us fortunate enough to have health insurance, the first $1,000 we pay every year has nothing to do with our health, our family's health, or even anyone in our insurance plan's health care. It's got to do with covering the uninsured.
So are you totally opposed to any tax increases to fund health care reform? Because if so, then where does $1 trillion in savings come from? Because I'm not going to buy that old adage that we can find it in the system.
I know that it seems hard to believe. The President thinks about 2/3 of this can come from savings. And as fiscal conservative Democrats, we believe that's correct. And that's one of the issues we have with this bill. We've been saying for 3 months, I've been saying for 3 months that the House health care reform bill does not go far enough at containing cost, at squeezing all the savings that we can out of the current health care system. And then about a week ago, a bombshell was dropped when the Congressional Budget Office Director, Mr. Elmendorf, a nonpartisan position, said, in fact, that the House bill did not go far enough at cost containment. And even President Obama has backed this up. As recently as Tuesday on CBS News, he said that he thought the Blue Dogs, the conservative Democrats, were rightfully demanding more cost containment measures in the current health care reform bill pending before the House.